probably really young. Sunday is practice.
No,
She's not gonna be able to practice very well.
Well, did you
And
see
then
her
Monday
new
she's
update that
probably
she got
gonna
now?
be hungover.
If you go to
That's
Barclays
Tuesday. I go like this
for
and
a heart attack or whatever, gorgeous.
and she
Yeah. Thing is though,
She has practice
I'm having nothing.
She has practice Sunday.
I'm gonna step in.
Oh, I'm not gonna, no.
Yeah, I booked
Yeah,
it, but I'm not
right.
late.
Everybody good to be bored for a little bit?
Yeah, because I went on the call by myself. the other day.
Rock on. All right, so we're gonna go over bloodborne pathogens, PPE. We all know it, we all do it. Some of us aren't so compliant with some. We need to be compliant. So basically, we're just gonna go over some slides, our objectives, our own emergency action contamination protocols are in our SOPs. We have documentation through your paperwork that is it all in the trucks and the clipboards, correct? If an exposure happens? No?
All the supervisors have it.
Okay. So all of our supervisors have our exposure paperwork. I'm not gonna read through every one of these. You guys can actually see them up there. I won't bore you to tears.
You must think I'm a fast reader.
Sorry. So the reason we do this is so that we're all aware of the hazards that we encounter daily, on our daily basis, with the jobs that we do, not only in our ambulances, outside the ambulances, at the hospitals, at residences, etc. And the main thing is always make sure that that scene is safe. Keep yourself safe, your partner, and then worry about your patients. So our plan, we have to have accessible 24 hours a day, 7 days a week. The reason that we do the training is that we need to be updated annually. Also, if a new hire comes on, they have to be initially taught the bloodborne pathogens program. So, put it in layman's terms, what is a bloodborne pathogen?
It's wet, sticky, and icky.
Exactly. So these are some of the examples. It's the HIV virus that can actually turn into AIDS, hepatitis B, hep C, hep D, syphilis, malaria. So whereabouts do you find these fluids? Any of these that are up here? Any of your cerebral spinal fluids? Any of your saliva, sputum, vaginal secretions, peritoneal fluids? I mean, this is everything that we could potentially run into. So other than coughing and sneezing on somebody, what are some of the ways that we can actually get exposed to these?
Needle stick.
Yep. Yep. And do we cover our needles when we're done with them?
We can't.
Correct.
No.
Thank you. And the other thing is, we all kind of forget this. You gotta go home at the end of the day. How much of that stuff is actually on our clothing? I mean, most of us do take that for granted. So do you really want to bring all of these creepy cruds home with you to share with your family, loved ones?
Or putting your boots on other chairs in the office or on the desk.
Very true. Very true.
Dashboard. Yeah.
So what's the best way that we can prevent any of our pathogens from sharing them with each other?
Soap and water.
Thank you. So if you can't actually get to a sink and wash your hands with soap and water, what's our secondary?
Alcohol.
Correct. So of course, some of your protection equipment is your gloves, your goggles, your face masks, your gowns, your booties, etc. So basically everything that we come in contact with on a daily basis is on our hands. We use our pens, we use our clipboards. I come over, I shake Kyle's hand, I've just given him whatever I might have on my hands at that point in time. try to keep everybody safe, including yourself. So most of our equipment that we have in our trucks will actually fall into this category because we do have the Tyvek suits, we do have the booties, we should have regular surgical masks plus our N95s. So normally we do our fit testing. What is the reason that we actually make sure these masks fit to our face?
They don't fit, they don't work.
No good.
Correct. Now, is somebody like Mark gonna be able to wear a N95 mask and get that seal that we need?
Once he shaves.
Right.
Well, if he lets it grow a little bit, he can just.
That's why we have razors on the truck.
What's that?
That's why we have razors on the truck.
Exactly, shave him before he
Hold
goes.
them down and dry shave them right there on the car.
Does everybody know there's a Papa out there on the wall?
I do.
So we do have the Papa in the bay for people such as Mark.
It's hanging on the wall of the bag, Jim.
There's a big red bag, says APL.
So when you guys have a single layer of gloves, anybody just kind of walk me through the correct way of taking off those gloves?
Inside out.
Have somebody else do it for you.
Right. So you're going to try to pinch your first glove, get it pulled up over inside your other glove and then out over so that you're trying to keep your hands free from the contaminants that are on your gloves. If you have 2 layers of gloves, same idea with the first and second layer. So you can see that this basically says hand washing is that #1 way of preventing bloodborne pathogens from getting swapped off to different people. So the best way to do this is actually get your hands wet, grab the soap, lather them up, and then actually scrub. And you want to do this for a minimum of 20 seconds. Sing the happy birthday song a couple times in your head, rinse, and then dry. So this basically shows you where we can actually get contaminants. A lot of us forget that this actually goes up the forearms to the elbows, depending on what type of call you might have had or what you got into. So again, this goes to the secondary way of cleaning your hands, but you want to have something that's got at least a 60% alcohol base in it, or it's not going to really do much of anything for you. So we have engineering controls. On our trucks, we have our sharps containers, jump bags, we have our sharp shuttles. It's basically anything that helps us prevent getting a contaminant. So, obviously, good work practices, wash your hands. Do not recap a needle. If you have to recap a needle, your cap is on the counter, somewhere away from you. You're going to put your needle into that cap and chase the cap across the counter. If you've got something that is soaked in blood, other matter, whether it be urine, etc., can those clothes go into a regular trash bag or should they go into a bio bag? Yep. So if you've got a couple pieces of gauze that have 3 or 4 drops of blood on it, can those go in the regular trash?
Yes.
Okay. So anything that we have that's going to have a hazardous material, blood, etc., you're going to see the universal biohazard sign, whether it be on a sticker, on the actual sharps container, or in the big bio bags.
Can I just interject there for a second?
You sure can.
About the bio bags.
Yep.
The big red can is gone. What was happening was people were throwing something in there and we would never fill it up, and it would take, 6, 8 months, and it smelled so bad because it was rotting stuff. We took a bag to Miles and they opened it up and went ballistic because there was stuff in there that doesn't belong in there. Like paper, doesn't belong in a bio bag. Like gloves, paper, none of that belongs in the bio bags. There was blankets that someone got a little blood on. They said, oh, this is no good. So that's why the big bags are gone. If you have a bio issue and you're at the hospital, there's bags underneath the seat. Do what you can there and get it. Arel had to decon the whole truck at Miles the other day because it was a norovirus type thing. So it may take you a little longer, but leave everything at the hospital. They have the right stuff, the right place to do it. On a side note, Teresa can confirm don't throw linens in the trash. If they're ripped, destroyed, whatever, put them back in the
blue bag.
in the blue bag, or at the hospital in their bags, because it all counted and they're all, if they dispose of them somewhere else. No, they're not disposing too many. I pulled one out the other day, it had 3 holes in it.
That's the thing.
So, but the bio, do everything you can at the hospital. Don't bring it back here. We're not storing people's puke and urine. So that's what was happening. It was rotting. So
In the dirty utility room at Miles, they have the whole setup. If you have the vacuum container, the suction container full of fluid, you go in, you get a bottle of that dry powder, you put it in, and then you just put it in their big barrel.
yeah, you may have to ask whoever the tech is for that day to do it, because I'm not sure where that stuff is, but they have it set up.
And they have bags in there too.
Yeah.
So,
MA does too.
yeah.
They've got the whole bio room.
Now, they want that done with any of the potential overflow of fluids.
Yeah,
the vomit,
anything that's
the-
bottled.
Okay. So what is the modes of transmission for any of these diseases that we could encounter?
Airborne,
Yep.
direct contact.
Yep. So the things that can affect us even more is basically the type of disease that we might into, or the pathogen, so to speak. It can be a very long time from the exposure of HIV to when you might actually have symptoms. Does anybody know what the baseline time is for that?
It's like 10 years, isn't it?
Correct. Yeah, it can be up to 10 years or even longer before you're actually going to get the signs and symptoms of that disease. So here we go with some of our modes of transmission. So your needle sticks, which that's our biggest one that we have to watch out for. Make sure that needle gets put into your sharps container. If you don't have a sharps container readily available, make sure it's, don't put it in the seats. Make sure that you can actually protect it for the time being till you can get it in the correct container. The other big thing that I know I'm lax on is not protecting my eyes all the time. People start to vomit, spit at you, etc. You can always end up with the pathogen in your eyes, in your nose, in your mouth, and it affects those mucous membranes.
We had a patient recently that got a needle stick from putting a needle in a sharps container because one was there that hadn't been actually pushed down, and that's how she got stuck.
Right.
So it's just something to think
Can I
about.
interject?
Yeah.
Because I'm the infection control officer for Waldeboro. And because you get a needle stick doesn't mean you had an exposure. And that's what my job is. If you do get a needle stick, call me. I meet you at the hospital, or I designate somebody else to meet you there, and we make sure that the patient had something in order to create an exposure for you. If you've got a splash in the eye, it's going to have to be pretty significant, because the first thing that's going to happen, your eye's going to start watering, and it's going to dilute that exposure so much that, once again, if it was an exposure. So everything I was taught in that class last year was, last spring, was it's not an exposure until you determine it's an exposure.
The other part to add on to what Richard is saying, does anybody know how long we flush the eyes for if we've gotten exposure?
Forever.
It's a minimum of 15, minimum of 15 minutes. So your airborne exposures, we have regular surgical masks. Do you have a question, Jared?
No,
Are you good?
I was
Okay.
stretching.
We have the regular surgical masks, but keep in mind those are not going to protect for TB. That is why we have our N95s that are considered a respirator form of a mask, because it is going to filter the air that comes back in.
Right now, the flu is out of control. The nurses are wearing. We need to make sure that we have some in the traps, and we're putting them on ourselves or our patient. Patient's puking, you can't put it on the patient, obviously. But if it's on, it's got to be on somebody. And so let's make sure that we have them. I know Arel's ordered them, but I'm not sure that they're inventoried. But I think they should be on the stretcher themselves in the little pockets so that you've got them when the patients are going in and out. And we need them, and then they need them. It depends on what's going on.
And you need to change them, what they say, what, every 20 minutes? You need to change them.
Correct. And we forget about that as well. I mean, we throw one on, we do our job, and we continue right on, where most of our transport times are 15, 20 minutes minimum.
And we're not using N95. We're
Right.
using just those paper type things.
A lot of people wear their gloves when they drive. They don't take
Oh.
off.
No.
Nothing's
gloves in the front seat, no.
No, as soon as you
Fingers
exit
crossed.
that patient compartment, get those gloves off on your way out the door.
If you're even working a car accident and somebody asks you to move the truck, take your gloves off and then throw another pair on. If you're gonna grab the steering wheel, take your gloves off. You're gonna grab a microphone, be on a microphone for a second, take your glove off, and then just put a clean one on.
But don't throw them between the seats and
No,
because
that's right.
that's where we find them more often than not. They take them off and throw them between the seats and they stay there.
In the back of the truck. Well, they shouldn't stay there. The truck should be looked at every day and picked up, so at least pick them up. But when I leave them in the back,
That's
if
where
you're
I've
outside the garbage
found
can,
them on
throw
my
the
truck
garbage can.
checks.
Yeah.
Find
Yeah.
them up front.
Yep.
I don't wanna be picking
So-
up nasty gloves from.
Some of
whatever
your
you did
diseases
yesterday.
that are, you can get exposed to by the droplets, of course, are your common cold, your flu, which is running rampant. The CDC has put out information that it is just unbelievable this year. Meningitis, your rubella, and whooping cough, and of course TB. So your indirect exposure, what is that?
Touch something that's touched something.
Yeah. So per se, you might have a little bit of a cut on your hand. You go and pick up some gauze that's saturated in blood. You could have just contaminated yourself if you do not have gloves on. And actually, this gives you an idea that the HIV doesn't live long outside the body, but your hepatitis does. Your hepatitis can actually live outside for about 7 days. So think of the things that we touch in the trucks, the handrails. A lot of people don't pay attention that we reach up, we grab, we've got our gloves on. Well, we've just contaminated that whole rail. You reach over, you turn the knob on for the oxygen. You've contaminated that. So luckily here, we do our deconning of our trucks on usually a weekly basis. So we're kind of cognizant of getting those clean. But think at the end of your call, if you remember touching something, just try to wipe it down.
We should be wiping down rails,
Yes.
handrails, the
Regularly.
bench, whatever. If you're touching the bleach wipes though, be very careful because you get it on you, you're losing color in whatever you touch.
Yep. And also, if you're using the purple wipes from experience, put your gloves on. They are very dangerous to the kidneys and liver. So this is a famous one for kids. Anybody who works with kids, has kids at home, or just people that are not cleaning themselves like they should after the restroom. We can pass on hepatitis due to fecal oral. And that is somebody who's gone to the bathroom, has not washed their hands, comes out, grabs their cheeseburger, takes a bite. A couple days later now they've got pukey, nasty GI mess. Find out a year down the road or whenever, they now have a hepatitis of some sort, which is usually Hep A. So this is basically what goes back to Jared was saying, if it's wet, sticky, not yours, don't touch it, assume everybody could be infectious. So the truth versus the fiction. This is a kind of a slide that I kind of threw in because if it's just a tiny, tiny little bit of blood that might get on your hand and doesn't enter your system, that's most likely not going to be a direct route into your body. So it's basically for like HIV, AIDS, it's really sexual transmission, blood transfusions, which does not happen like it used to years ago because the blood is so well processed and filtered and checked and taken care of. Whereas sharing needles, which I know we're finding a lot more of because people are doing carfentanil, heroin, whatever you may have for your drug addiction, they're injecting into them. They could hand off the needle. Somebody else has now injected that, so now they're sharing creepy crud together. You cannot transmit HIV by toilet seats, provided they're not saturated with whatever, and you decide to really set into it and it absorbs. But it's usually not transmitted by the toilet seat. Utensils, food utensils, not transmitted by that. Mosquitoes don't take enough blood to actually keep on themselves and then interject it into somebody else. So HIV, the incubation, like we said, it could be a year to 10 to 15, you just don't know. So protect yourself from not having to worry about it. If you have the antibodies, they're going to develop within that 6 to 12 week post-exposure. You might be able to fight it off. Your immune system just may not be strong enough, and you're going to develop it sooner than you would have. So hepatitis, we see this one quite often. Is there a treatment actually for hepatitis now?
Treatment for everything.
Very expensive.
It is, it is. A lot of people that we see that are alcoholics could be infected with hepatitis. It could be self-induced. It could be something that they got years ago. It basically will shut your liver down, hence is the jaundice picture that you see here. It will come on as like a flu-like illness. You'll have the weak, the malaise, loss of appetite, your belly hurts, you're gonna be pukey, the light-colored stools, etc. So it can survive at least a week in the dried blood on the outside surfaces. So think of that little spot on the handrail. Well, guess what? It's live for about a week. So there is a vaccine. I think everybody here has either had it or had to have it at some point in their career. It's usually a course of 3 shots. First one, and then it's 6 weeks later is the second, and then 6 months later, I believe, is the third. Oh, it says right there. Ha, see?
The problem is that we don't require it, but in order for you to get an EMS license in the state of Maine, they make you do it. So if you need to take a class, I should say.
So Hep C is the one that can lead to cirrhosis and or cancers. 75 to 85% of the infected people will end up with a chronic infection. And the incubation is anywhere from 2 to 25 weeks. So this just kind of goes back, it's the same type of symptoms, that flu type feeling. So TB, how many cases of TB have we run into, any of us here, in your career, anything?
Like 2 in my entire
Yeah,
I think I've only run into 1. But this is big. You go back years ago, people ended up in asylums, so to speak, just because it was very prevalent. It was a TB ward. It just gets passed back and forth with the droplets. So really protect yourself with those N95s.
A&W found it years ago because of the masks the guys were wearing and weren't cleaning them good enough inside.
Oh, so they were sharing, yeah.
Very scary.
Right? So again, this is where you're gonna have the fever, the chills, the weakness, malaise, fatigue, sweats. The night sweats is kind of a really big one. You'll have a cough that's usually productive, and that cough is live. It will infect somebody else. So this is where we need the respirator type masks, the N95s or any one of the other designed respirator masks. The surgical mask will not protect you with TB, from TB. So chickenpox, everybody had chickenpox in here? I've never had them. Terry's probably never had them. Aaron hasn't had them. So there's a few of us.
Yeah, but Aaron probably got inoculated. He's young enough.
Yeah, he probably did. I know I went and had titer drawn. I do not have the antibodies. For some reason I'm still, knock on wood, am safe for now. Most of our elder population end up with shingles. They can be transmitted because it's the same idea. It's an open weeping sore. I try to take extra precaution if I do have them, just because I haven't had the chicken pox, and I could end up worse off. It's hard to say. So with your shingles, it ends up being more of a nerve related, so they're very painful. They will usually work on one side of the body versus the whole side. Most people I've talked to, it is just unbelievably painful because it is on that nerve base of the skin. Do you know anything else more about?
Use airborne.
Yeah, so use your airborne precautions. Glove up. If they're really oozy weepy, try to keep them covered as well to protect them and you. So the virus itself will die quickly outside the body, but it is contagious a couple of days prior to actually seeing those rashes. I know chickenpox, they used to say, was like a week prior. So this goes part to the shingles part. There's actually a girl that I used to work with who will break out in shingles, and hers usually locates to the lower corner of one side of her face or the other. And that is actually a repetitive thing for her. So bacterial meningitis. I know I've run into a few cases of this over my time, and it's pretty scary. Meningitis actually messes with the lining of the brain, the meninges, and it can cause some very serious problems between the brain and the spinal column. The incubation is anywhere from 2 to 10 days. You're going to end up with an extreme fever, very bad headache, stiff neck, nausea, vomiting. With the infants, always keep an eye out. They're not eating like they should. They're obviously not going to have wet diapers because of the lack of appetite. They do have a vaccination for this for the children. Did they have one for you, Aaron? Were you in that era? Do you know?
I think he may have.
Okay.
I think he may have been.
You might have
I
been.
was
You
young.
might have been in that,
Yeah.
that time frame. Most people that are in this career have been here for a while. It wasn't something that we had when we were growing up. So there's actually a bacterial meningitis and a viral meningitis. Your viral is actually more common and less dangerous, but just remember it can get pretty ugly. And a lot of these infections, because it's the brain and the spinal column, will leave you with nerve damage, brain damage, etc. So flu, obviously that's what we were discussing just recently. Incubation's anywhere from 1 to 5 days. You're always contagious 3 to 5 days after your symptoms have come on. And then at the end of the cycle of it, you're not as contagious. You get the rapid onset, the high fever, muscle ache, sore throat, you may end up with a cough. Biggest thing we can do is wash our hands. Keep everything clean. Everybody get the flu vax here this year? Pretty much, no?
Yeah, but that's not the time.
And that's kind of a problem that we're running into. We get vaccinated for a strand. Well, there could be 4 or 5 different strands that break out in a year. So it's protecting you maybe from one. So try to keep that in mind when you go take care of patients that might have either influenza A, influenza B. It's still very contagious. So there's controversy on vaccinations for kiddos, parents that either so choose to or not to have their children vaccinated. This could be fought, debated in politics, and it's whatever you want to do. You want to protect yourself, protect yourself. If not, that's your choice.
We're finding a lot more parents don't want to have those kids vaccinated in our office.
Yeah.
Until there's an outbreak at school.
Right.
Then they want to.
Right.
But it's those kids that are bringing it in.
Yeah.
So as this says, advice to avoid the flu. None of us usually follow these rules. Plenty of rest. Eat healthy,
What is rest?
right?
For EMS.
Manage the stress, okay, really, and stay physically active.
What's physically active?
Always remember, because I can tell you,
Don't be a dispatcher.
I didn't really ever pay attention to it till I was putting this together of how many times we touch our face in a day. They actually say on an average, it's 25 times within a minute. And you don't pay attention to it till you actually think about it. So pertussis, a lot of the kids, when we were younger, it was whooping cough, no big deal. Well, guess what? It is a big deal. They have vaccinations now for anybody that's going to be around newborns. I believe it's grandparents, parents, siblings. They try to have them all vaccinated so that you do not pass this on in the families.
We give it to maternity patients at 28 weeks.
At 28?
We offer it again. Most of them decline.
Now, does that helps the mom? Does it also
It helps
protect the
cover
baby?
the baby until the baby gets its
Yep,
vaccines.
okay. So the vaccination is called a DTaP.
For moms, it's Tdap.
That's right, because it's more of one than the other.
Yeah,
Thank you.
but if they say one or the other, you know they've got it.
So some of the things that you could actually run into with these poor little buggers, because they cough so hard, is a pneumothorax, fracturing ribs, and they can end up with becoming hypoxic because they cough so hard and it's a long period of a cough. They just expel too much oxygen. So staph infections. How many of these do we run into every day?
More than we probably want to know.
Right.
Everybody's infected until proven otherwise.
Yeah, exactly. So this will say most of these infections are minor, like a skin pimple or a boil. Well, they can turn into something pretty ugly that will can start as a staph, turns into, say, a MRSA, because now it's resistant to any of the antibiotics that they try to use. This will actually show you that methicillin, the oxacillin, the penicillin, the amoxicillin, these are what are usually the antibiotics that's resistant, or the disease is resistant to those antibiotics. And the biggest thing, frequently among persons in hospitals and healthcare facilities. And then this says right here, are usually manifest as a skin infection such as a pimple or a boil that will turn into something that is a community-associated MRSA. So a couple of little pictures. You can see the one on the right of the leg. Not real bad yet, but it's getting pretty ugly. Looks like a little bit of a cellulitis. The foot on the bottom left, definitely brewing a nasty infection. And the one in the middle is actually where they had to do like almost a fasciotomy to actually pull the skin and the affected muscle tissue and fat layer so that it can actually try to heal. So the biggest thing with this, and whether or not we pay a whole load of attention, we've wrapped those people up in our blankets. We've transported them. Those blankets are contaminated. The stretcher's contaminated. Anything on the stretcher could be contaminated. This can pass on just a little bit of a oozing situation from the wound. Try to dispose of everything appropriately. And we do this all the time. It says do not use the sheets from the bed that the patient was lying in.
Of course.
But we all move our patients from the sheets that they were lying in. So then, of course, you have the VRE, which, of course, is another resistant, it's the vancomycin resistant. Of course, basically, it's all of us that are in healthcare that end up having to deal with these. And obviously, you can see it's usually from a urinary tract infection, wound, or a blood infection. VRE is transmitted, obviously, by fecal matter. Anything that's a contaminated piece of equipment, whether it's ours, the hospital's, theirs, from home, people are not as cognizant of keeping themselves clean and washing their hands as much after going to the bathroom at home as they are out maybe in the public.
Did he wipe himself without any toilet paper at all? That's a lot of fecal matter.
Right? That just means they didn't wash very well. C. diff is another one that we run into very often. And I remember correctly, C. diff is one that has to be cleaned up with bleach and bleach only is the only thing that will actually get rid of it.
And with the hands,
Most-
it has to be soap and water.
Right. Most people that end up with C. diff, they've been on an antibiotic. And it's usually an antibiotic that really just kind of wrecks the GI system. This is something that's usually gone on for anywhere from 7-10 days. Some people that end up on antibiotics for 21 days and greater. So anybody that we run into on a daily basis, people on antibiotics, people that have been in a healthcare setting for any length of time, advanced age. We all live in a society of a lot of retired age people and a lot of elder people. So they end up with the watery diarrhea. Usually it's pretty explosive. Fever, the loss of appetite, the nausea, vomiting, the abdominal pain. So again, wash your hands. Alcohol does not kill C. diff. So the norovirus, basically the flu, ends up being a little more drastic on the GI system. And your symptoms can be anywhere from a day to 2 days after you've been exposed to it.
Well, you're on about 36 around. You're on 24 right now.
Oh, I know. So your norovirus can actually stay active in your stool for anywhere up to 2 weeks. You'll end up with abdominal pain, the nausea, the vomiting, the diarrhea, etc. You could end up with a headache and fever. It might get better within 1 to 3 days. So right here it will show you the disinfecting combination should be a 5 to 25 as far as a gallon of water for your bleach. So Ebola, we ran into that a couple of years ago. Haven't seen much of it this year. Basically, if we were to run into this, we would try to protect ourselves with whatever we have, but we'd also hope to get some, is it Class A suits, I believe, that they use for Ebola. 2 to a 21-day incubation period, and that's after you've actually come in contact with the Ebola patient. So your transmission, of course, is a direct route. Anything that has been contaminated, whether or not the animal might have had Ebola and you've played with that animal and now you've brought it home to yourself and your family. And again, this one is a 1 to 10 bleach solution, or the purple top wipes can be used. These are your signs and symptoms, pretty much that flu type symptom. So basically, this is why everybody asks, have you been outside the country within the last, is it 21 days? Yep. And most of the time you're going to end up isolated. The hospitals do have pressurized rooms that they can put you in to keep you safe, plus everybody else safe. They're usually filtered through with filtered air. See, in the CAVA I still don't quite agree with that slide, because I don't believe it does on the C. diff. And this is pretty much just redundant. So these are some of the chemicals that we usually use. Always try to remember to do your bleach in a 1 to 10 solution. Of course, if it's a little more, it may not, might get rid of the virus, but you're gonna probably danger yourself because now you're exposing yourself to way too much bleach.
We do have the wipes that have the bleach in them.
Do we? Yep. Yeah, right there. So your purple top's not effective against the C. diff or the Ebola. And this is something we don't do, and I'm one of those. I usually wipe a stretcher, let it dry really quick, throw my blankets on. You probably should let it dry a lot longer. Your purple tops, it says 2 minutes. your morning mist, which is what we carry in the laundry room.
Just stay wet for 10 minutes.
Yeah,
not
you're
dry.
supposed to keep it wet for 10 minutes, so it actually is trying to kill that virus, and then wipe it down if it's still wet, but let it dry. Your best bet is to let it dry.
Yeah.
And we all know this. So this is one that if you got an exposure today, they check their patient currently doesn't have anything. They keep the records on file because that patient could develop something 10 years later, 20 years later, and then all of a sudden now you've got to worry about yourself because you had that contaminant from that patient. Records will usually stay in most places for up to 30 years. So again, if we get exposed, Richard already let you guys know that we have to let him or advise him of the incident. He can meet us over to the hospital, find out whether or not that patient has actually got something that we could have caught. You're probably going to get blood work done if there is question of it, both you and the patient, and you'll go from there. Whether or not they start a prophylactic type of treatment, just in case, if the patient says, yeah, Hep C positive, they might start you on something prophylactically. I know when I had an exposure to meningitis, they gave us a brutal dose of Cipro just as a prophylactic. Is that all still current, Richard?
That may need to be adapted a little bit to
A little bit.
what you did, because that was before you were.
Right, this was the one I
designated.
That's
stole
pretty-
this
that's
slide
pretty close.
from last year, so. So in our SOP manual, we do have this written down. We may just adjust it a little bit because Richard took a pretty awesome infectious control class. So our exposure forms, Richard should have these, and the supervisors should have these. Please notify a supervisor as soon as possible. Best thing is if you do get a needle stick or an exposure, flush, 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 wash, 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 then let somebody know what happened. Anything for a question, or did I bore you?